And we are live on Facebook. Magandang umaga po sa inyong lahat. Ako po si Laura Saison mula sa Kagawaran ng Kalusugan, and I welcome you to another town hall session brought to you by the Communications Management Unit of the Department of Health. In the past week, there have been discussions whether the national government is adjusting its goal of herd immunity, from herd immunity to population protection, just because of limited supplies. And the Department of Health has clarified that our goal of vaccinating 70% of our population, or even 100% of our eligible population, remains to be our goal. However, in the context of scarce resources, our experts, particularly the INITAG and the Department of Health, have embodied in the principle of our prioritization framework the protection of the most vulnerable. And our tangible goals would be to reduce hospitalization and prevent deaths. To provide us an overview of today's town hall, I give you the Undersecretary and our official spokesperson and the convener of the all-expert group, Undersecretary Maria Rosario Singh-Vergere. Yusek.
Thank you, Laura. Magandang umaga po sa inyong lahat. Bago po tayo mag-umpisa, gusto ko lang pong batiin ang mga kasama natin ngayon dito sa town hall na ito. Unang-una, gusto ho nating ipaalam sa lahat that Secretary Francisco T. Duque will be joining us in a little while after his morning meeting. We have today Undersecretary Emmanuel Ray Caintic. He is the Undersecretary for Digital Philippines, DICT. We also have Mr. Christian Edmund Chua, Technical Consultant of DICT. We have USEC Mario Iringan from DILG. We have Director Aleli Sudyakal from the National Vaccine Operations Cluster of DOH. And of course, we have our health experts. Nakapatuloy po tayong tinutulungan mula pa ho nung umpisa. We have Dr. Ana Ong Lim from our Technical Advisory Group of Experts. We have Dr. John Wong. He is a resident epidemiologist. We also have from the local government, Honorable Mayor Francis Zamora from San Juan City. We have Brian Jelly from the Chief Information Office of San Juan City. Aside from that, we have invited from DILG, USEC Epi Densing, USEC Martin Dino. We have Attorney Odilon Pasaraba. We have Marcelo Morales. And of course, we are recognizing all DILG officers from the central offices and regional offices. Also from MMDA, we have invited them, Chairman Benhar Abalos, USEC Jojo Garcia, their General Manager, Attorney Vic Trinidad, their Director for Public Safety Office, and then all from ULAP, we have invited Governor Dax Cua and Governor Presby Velasco, Director Bernie Sayo, and all of their officers and executive board members. We also like to recognize the League of Provinces of the Philippines, the League of Cities of the Philippines, League of Municipalities, Provincial Board Members League of the Philippines, League of Vice Governors of the Philippines, League of Vice Mayors of the Philippines, Philippine Councilors League, National Movement of Youth Legislators, Lady Local Legislators League, and Liga ng mga Barangay. So yun po lahat ang ating inimbita para makapagbigay po tayo ng sapat na impormasyon para po sa ating mga implementers, sa ating mga local governments, and of course to our public. So can I have my slides, please? Excuse me. So ito pong aking ipapakita ngayon is just an introduction kung ano po ang mga ipapaliwanag sa atin mamaya ng ating mga eksperto kasama ng ating mga kasama sa national government agencies. So ang ating usapin po ngayon sa town hall ay kritikal sa implementasyon ng ating programa sa pagbabakuna. Hindi po lingid sa atin na ang kasalukuyang supply ng ating mga bakuna sa bansa ay hindi pa po sapat upang agarang mabigyan ng bakuna ang bawat Pilipino. Bilang tugon dito, nagsasagawa po tayo ng vaccine prioritization upang matiyak natin na ang limitadong supply ng ating mga bakuna ay magagamit upang magbibigay ng lubos na benepisyo at proteksyon para sa lahat. Mahalagang alalahanin natin na ang pagsagip ng buhay ang layunin ng ating pambansang pagbabakuna. Kaya naman nagpapatupad po tayo ng mga strategiya na makakatulong upang makamit natin ang layuning ito. Hindi kailanman naging layunin ng ating prioritisasyon ang ipagsantabi ang kahit na sinong Pilipino. Habang totoo na may grupong mauuna, nakakasiguro pa rin po tayo na ang lahat ng pwedeng bakunahan laban sa COVID-19 ay mababakunahan. Ngayong araw, tatalakayin natin kung paano tumatakbo ang ating prioritization framework sa pagbabakuna laban sa COVID-19 nang sa gayon ay makapagbahagi po tayo ng wastong impormasyon sa ating kapwa. Mahalagang bahagi ito ng ating inisyatibong mapataas ang vaccine confidence sa ating bansa, kasabay ng pagsulong ng pagsunod sa tamang proseso ng ating pagbabakuna laban sa COVID-19. Bago po natin makapanayam ang ating mga eksperto, maiging daanan lang muna natin ang prioritization at master listing guidelines at mga sistemang nagpapatakbo nito. Habang alam po natin na kinakailangan ng agarang kilos upang tugunan ang peligro ng pandemyang COVID-19, kritikal po ang pagiging mahusay ng ating mismong responde. Ang ating prioritization ay isa sa mga stratehiyang ating ginagamit upang matiyak na ligtas, mahusay at mabisa ang paghahatid ng dagdag na proteksyon ng bakuna sa bawat Pilipino. Gaya po ng inyong nakikita, meron po tayong 3 criteria na sinusunod sa ating prioritization. Ang mismong priority groups na galing sa WHO Strategic Advisory Group of Experts on Immunization or WHO SAGE, ang caseload ng bawat local government at ang kinikilalang sub-priority groups. Ang bawat criteria na ito ay kalakip din ng maiging pagsusuri. Dalawa po ang layunin ng ating prioritization, ang pagsasagip ng buhay at ang pagpapanatili na sapat na kapasidad ng ating health systems. Sinusundan po natin ang sistemang ito dahil ito po ang pinakamahusay na paraan upang tiyakin natin na ang pagbabakuna ay naaayon sa pagtugon ng lubos na pangangailangan. Isang napakalaking bahagi ng ating prioritization ang ating master listing. Next slide please. Kung saan kinikilala natin ang mga individual na bahagi ng ating priority groups. Mula sa ating master listing, natutukoy natin kung nasaan at ilan ang miyembro ng ating priority population. Mula po sa datos na ito, nabubuo ang ating vaccination targets, bukod sa iba pang projections and metrics na ating ginagamit upang suriin ang takbo ng ating programa sa pagbabakuna. Sa ating master listing din nagsisimula ang pagbuo ng ating mga proseso sa vaccination sites sa mga local governments. Dahil kinikilala po natin ang iba't ibang kapasidad ng bawat komunidad at nang sa gayon ay mabigyan natin sila ng angkop na tulong sa iba't ibang capacity building activities. Next slide. Sa likod ng lahat ng ito, kritikal ang mahusay na data management upang maging mahusay din po ang takbo ng ating programa. Sa larangang ito, nariyan po ang sistemang binuo ng Department of Information and Communications Technology or DICT. Katulong po ang mga sistemang ito na nagpapadali sa galaw at update sa ating mga datos upang mabantayan ang takbo ng ating pagbabakuna. Tiyak din ang integration ng mga sistemang ito sa iba pa nating data management systems. Nang sa gayon, sa lubos ay maging mas mahusay ang ginagawang mga pagsusuri ng datos na siyang nagiging basihan po ng ating pagpapaigting ng ating mga polisiya at inisyatibo upang labanan ang COVID-19. Next slide. Noong May 31, 2021, nakapaghatid na po tayo ng 5.2 million doses ng bakuna ng COVID-19. Mula dito, 4 na milyon po ang para sa unang dose at 1.2 million ang kompleto na ang dose ng kanilang bakuna. Para sa A1 or mga healthcare workers, meron po tayong 1.3 million na nakakuha ng first dose at 689,992 naman para sa second dose. Meron po tayong 1.3 million na senior citizens ang nakakuha ng first dose ng bakuna at 257,812 ang nakakuha ng second dose or fully vaccinated already. Para naman sa A3 o yung mga taong may comorbidity, 1.2 million ang may first dose at 293,600 ang nakakuha ng second dose. In the continuation of our symbolic Labor Day vaccination of members of Priority Group A4, 10,827 had been given their first dose and 3,178 had been given their second dose. sa bawat bakunang ating hinahatid sa mga healthcare workers, senior citizens, at those with comorbidities na pinaka-vulnerable sa COVID-19, nagagawa po nating i-maximize ang current supply ng ating bakuna sa pamamagitan ng pagbibigay ng mga bakuna sa mas nangangailangan. Gayunpaman, bagamat bakunado na, hindi pa rin po tayo dapat tumigil sa pagsunod ng ating minimum public health standards at safety protocols sa lahat ng oras. Atin pong tandaan, ang inisyatibong ito are also equally important measures upang maprotektahan tayo laban sa COVID-19. So bilang panghuli sa ating town hall ngayon, makakasama po natin si Dr. Ana Ong Lim mula sa ating Technical Advisory Group, si Dr. John Wong from Epimetrics, sina Undersecretary Emmanuel Caintic at Mr. Christian Chua ng Department of Information and Communication Technology, and Mr. Brian Gelly ng San Juan City para talakayin nila ang mga bumabalot sa ating prioritization, master listing at registration ng mga issues. Narito rin po mamaya-maya si Secretary Francisco T. Duque at si Yusek Mario Iringan ng DILG upang makapagbigay po ng kanilang mga mensahe at makasagot ng ilan sa mga katanungan mamaya. So, Laura, over to you.
Maraming salamat, Yusek Berhere. Now, for giving us an overview. To open our town hall today, may we call on Undersecretary Emmanuel Ray Caintic of the DICT. Yusek.
Thank you. Magandang umaga sa lahat. Thank you, Yusek Rosette, for inviting the DICT and all the representatives of various LGUs in this town hall. We expect to actually answer more questions than to tell you about what we are doing. We will do that, but we will also be ready for questions so that we can clarify, as what you mentioned earlier, tatlong bagay, no? Importante yung master listing kasi for our demand and targeting planning, kailangan pa rin po. I-highlight ko lang din na mamaya makikita nyo kung gaano ka-importante din na malaman nyo kung sino ang mabakunahan ninyo para for your crowd and queue control. Gusto nating maging matiwasay at gusto nating maging orderly ang ating pagbabakuna. We want to give a pleasant and orderly vaccination experience. Pangalawa, i-emphasize ko lang as we will expound later, importante po talagang i-akyat ninyo ang inyong mga vaccinated line list. Alam ko, nahihirapan kayong kumpletuhin ang mga datos, pero important po because hindi ko palang pwedeng discuss ninyo ngayon, pero kailangan po talaga yan kasi magbibigay tayo. We are going into creating vaccine passports for international and sea and air travel and possibly contemplating on domestic travel. Hindi ko pa pwedeng i-share kasi pinag-uusapan pa lang ng maayos ang polisiya tungkol dito sa IATF. Pangatlo, importante po din talaga na ilabas at iakyat ninyo, ibigay ninyo sa DICT or sa NBOC. DICT I think because kami na ang bahala sa NBOC, sa mga counts, yung bilang. Hindi lamang doon sa nabakunahan, importante yon. Religiously on the dot sana before 6-7 p.m. Pero important din po apart from yung list yung bilang na nabakunahan nyo, pati rin sana yung mga supplies, ancillary and vaccine supplies. So as we're moving towards July, August to the end of the year, all the more kailangan natin ang datos ng counts at pati din yung listahan ng inyong nabakunahan. Dapat, I think si Mayor Francis Zamora or yung San Juan will talk about yung vaccination system on the ground na ginawa natin. Hindi po natin ito ginawa para mag-duplicate kung sino man ang meron ng system. Pagkus, kailangan po natin gamitin ang isang sistema para mapabilis ang inyong pagbabakuna on the ground. Kasi ang objective natin sa vaccine information is to assist the vaccine program na mapabilis, maparami ang ating pagbabakuna araw-araw. Panglima, gusto po nating sabihin na kasama po sa expectation is magsabi kayo in advance kung kailangan ninyo ng kagamitan. Although limited ang funding ngayon, pero sabihin nyo kung kailangan nyo ng kagamitang technical, tablets, keyboards, and internet. Kasi ang objective po natin is para maging online as much as possible, or kung hindi man maging online, may padala ninyo ang datos agad-agad, araw-araw. I know this is an opening remarks, but I cannot emphasize any further as what Yusek Rosette also emphasized, that we need data. We need data to plan. We need data to manage the supply and demand. And we need data para sa inyong mga constituents para ma-issuean natin ng vaccine passports ng maayos in the next few months. So thank you, Yusek Rosette, and all the attendees today. Hindi ko na po papangalanan lahat ng mga kaibigan natin dito, pero maraming salamat sa pagkakataon na ito. Mamaya, mag-discuss ang DICT ng detalye ng interoperability, pero makinig muna tayo sa bakit kailangan talaga ang prioritization and master listing before we talk about the technicals. Maraming salamat po sa inyong lahat and mabuhay. See you later.
Maraming salamat po, Yusek Manica Intik. And to begin our technical discussion on the prioritization framework of the part of the National Vaccination Program, I give you Dr. Ana Ong Lim of our Technical Advisory Group. Dr. Ana, the floor is yours.
Maraming salamat, Laura, at magandang umaga sa ating mga kasama ngayon. Ngayon, tatalakayin ko ang layunin ng ating prioritization. No? So this is not basta-basta lang na hinugot sa kung saan, kung hindi meron talagang pinagbabasihan. And importanteng maintindihan to dahil malaking bahagi ng ating mahusay na paggamit ng supply ng bakuna sa ating bansa, yung pagsunod sa prioritization framework. And ang objective talaga nito is masiguro na magagamit ang ating bakuna sa paraang makakalubos ng proteksyon at benepisyo sa lahat ng constituents natin. So can we move to the next slide, please? So bilang pauna, balikan muna natin ang layunin ng National COVID-19 Vaccine Development or Deployment Program. Gusto sana natin na makarating tayo sa 2023 na mayroong ligtas, patas at abot kamay na pagbabakuna para sa lahat ng Pilipino. Kailangan nating harapin, no? However, na meron tayong limitadong supply. And bilang tugon dito, gumagamit tayo ng prioritization framework na sumusunod din sa rekomendasyon ng World Health Organization. May tatlong objectives or goals itong ating framework. Unang-una ay makapagbakuna para lubos na mabawasan ang peligro sa buhay at maipagpatuloy ang critical services or essential services. Buhat nito ang paglalagay ng healthcare workers, senior citizens, at mga individual na may comorbidities sa unahan ng ating priority list dahil sila na nga yung may pinakamataas na peligro at exposure sa COVID-19. Ang ating secondary goal, no, ay ang layunin na pagkontrol ng pagkakahawaan at ang lubos na pagbawas ng masamang epekto ng pandemya sa ating lipunan, sa ating ekonomiya at sa seguridad ng ating bansa. Kaya naman dito inilalagay yung tinatawag nating essential workers na susunod sa priority group. Ang tertiary goal o ang ating hinahabol naman no overall is makabalik sana tayo sa pamumuhay bago dumating ang pandemya. And dito na pumapasok ang mga Pilipino na hindi nakasama dun sa naunang priority groups, yung A1 to A3 and finally yung A4. And kinakailangan muna nating tiyakin ang kaligtasan ng ating buong bansa bago nating sikaping makarating dun sa tinatawag nating quote-unquote normal. Next slide, please. However, we recognize na talagang hindi sapat ang supply ng bakuna. And hindi lang to problema ng Pilipinas. This is a problem across all countries globally. And bilang tugon sa limitadong supply ng bakuna sa ating bansa, kinakailangan na tiyakin na ang bakuna ay maibibigay sa mga sektor ng lipunan na mas mataas ang chance na sila ay mahawa at mamatay dahil sa COVID. So unang-una na nga dito yung tinatawag nating A1, A2, and A3 sectors na kabilang doon ang ating frontline healthcare workers, ang senior citizens, and those with comorbidities. Kasabay nito, mayroon pa tayong naidagdag na dalawang karagdagang criteria na ginagamit upang lubos na ma-refine ang ating prioritization. So ang criterion 1, the identified priority group should be given nationwide access before the next priority group comes online. And if the incoming vaccine supply is less than the number of people in the population group selected for vaccination, then doon naman tayo papasok dun sa criterion 2 para mapili kung sino ang uunahin within that framework of nationwide supply. So for criterion 2 naman, we consider the geographic location based on number 1, burden of disease, and number 2, the LGU's readiness to effectively and efficiently deploy vaccines. So we've been implementing this since the past few months, where we funnel the majority of our vaccine supplies to the NCR, where we experience an increase in the number of COVID-19 cases. So kung kulang pa rin, so unang-una tinignan muna natin sana whole of nation na masasakop natin yung A1, A2, A3. Kung kulang, pipiliin natin yung mga geographic locations, ipaprioritize natin. Kung kulang pa rin, then pupunta na tayo dun sa criterion 3. Which is, we consider the sub-priority groups based on exposure and mortality risk. So dito natin sinisiguro na hindi lang basta-basta yung pagdidistribute ng bakuna kung hindi masusupply pa rin natin ayon dun sa primary goal of reducing morbidity and mortality while maintaining the most essential critical services. Next slide, please. So, hindi naman din natin dinedeny na meron talagang issue ngayon tungkol sa brand ng bakuna. And dapat ulitin na hindi priority ang pagpili ayon sa brand. Dahil ang lahat naman ng bakunang ginagamit natin sa programa ay dumaan sa masusing pag-aaral at pagsusuri. And tanging yun lamang na pumapasa dun sa ating mga standard ay ang binibigyan ng emergency use authorization ng Philippine Food and Drug Administration dahil natitiyak natin na itong mga produktong to ay ligtas at epektibo. So, I think the message really is that people can be assured na pagka may EUA ang isang bakuna, anumang brand ito, siguradong-sigurado tayo na ito ay ligtas at makakapaghatid ng mabisang proteksyon. So currently, ang meron po nating mga bakuna na may EUA ay ang Pfizer BioNTech, AstraZeneca, si Sinovac, or actually the trade name is CoronaVac, Sputnik, ang Janssen, Covaxin, at ang Moderna. So importante ring matandaan na patuloy pa rin ang pagsusuri sa mga bakunang ito. And habang napatunayan na ang pagiging ligtas at epektibo ng mga ito, patuloy pa rin nating tinitignan ang mga developments ng mga vaccine manufacturers ayon sa kanilang mga report. So tulad na lang nitong nakaraan na nagkaroon tayo ng temporary pause sa paggamit ng isang bakuna, this is actually proof na ang ating sistema ay gumagana. Yung EUA, the spirit of the EUA, which is constant monitoring and constant evaluation nung safety and efficacy data, allows it to implement immediate pauses kung kailangan. And makikita natin na itong particular safeguard na ito ay napakahalaga to make sure na ligtas ang ating recipients ng bakuna. Now, meron pa rin tinatawag na clinical trials na ginagawa sa ating bansa, and pinapahintulutan ang paggawa ng mga clinical trials ng ilang manufacturers dito sa ating bansa. bago naman ito payagan, no, nakakatiyak tayo na binabantayan ng ating gobyerno ang pagpapatakbo ng mga clinical trials para sigurado tayong lubos ang benepisyo sa mga sasapi or magbo-volunteer na sumali sa mga trials. Next, please. So, meron tayong itong mga prinsipyong naibahagi ko ngayon lang, yun ang ating governing principles. Pero sa kabila ng lahat na ito, alam natin na talagang limitado ang supply sa ating bansa. So marami ang kailangang bakunahan, and right now, hindi sapat yung dami ng doses na meron tayo. So ang tanong actually is, how do we make this happen? O paano natin ito gagawin? Paano nating agarang maihahatid ang proteksyon para sa lahat ng Pilipino kahit limitado ang supply ng ating bakuna? So ang mga tanong na ito ang sasagutin natin. Ngayon naman dito sa process ng COVID-19 vaccine prioritization. Next slide please. So ang mga rekomendasyon para maabot ang layunin na ito include maximizing the current supply of vaccines by prioritizing the most vulnerable to save the lives of those most at risk. So again, bumabalik na naman tayo dun sa objective. Ano ba gusto nating maabot dito sa programang ito? Hindi ba yung mapababa yung kaso at masiguro na yung mga magkakasakit ay hindi aabot dun sa malubhang kalagayan o kaya mamamatay? Kasi nga, sabi natin, hindi naman talaga natin ma-expand yung ating healthcare capacity dun sa dapat nating abutin dahil very limited ang ating resources. Pero kung masisiguro natin na ang pinaka-vulnerable ay ma-cover natin ng maayos, hindi tayo masyadong kakabahan, naaabot na naman tayo dun sa critical healthcare utilization na nagiging source ng mga lockdowns na pinapairal natin every so often kung nagkakaroon ng surge. Kaya natin kinakailangang unahin ang may mga pinakamataas na risk sa COVID-19 para malubos ang proteksyong hatid sa kanila ng kasalukuyang supply ng bakuna tungo sa lubos na pagsagip ng buhay at proteksyon ng pinakanamimiligro. The second recommendation is to focus also on accelerating vaccine deployment as a strategy to reduce deaths and severe disease and also to facilitate opening of the economy. Alalahanin natin na hindi lamang kalusugan ang ating sinesafeguard, kung hindi, pati na rin ang ekonomiya at pinansyal na kapakanan ng ating bansa. So we have to make sure that lives are protected at the same time that livelihood is also protected. And we have to recognize that we won't be able to move forward in terms of livelihood if we don't protect lives. So talagang magkadikit itong dalawang objective na ito. So para marating yung goal, ang pagpapabilis ng ating pagbabakuna, the vaccine deployment process ay isa sa mga susi, and we need to ramp up our operations so that those who are most vulnerable to develop COVID-19 severe disease and death are reached at the earliest possible time. The next objective is to intensify local efforts and maximize opportunities to reach out and register and vaccinate A1, A2, and A3 priority groups. So bukod na sa ating mga inisyatibo upang abutin ang mga kabilang sa ating priority groups, kinakailangan ang aktibong paghahanap at paghihikayat sa mga nasa grupong ito na magpabakuna na. Maaring meron pa sa kanila na nag-aalinlangan o kaya nagdadalawang isip tungkol sa pagbabakuna. Therefore, importanteng marinig ang boses ng kanilang mga lokal na pinuno. And ibigay natin ito nang sa gayon ay piliin nilang tangkilikin ang proteksyon ng ating mga bakuna. Next slide please. Kailangan din ang ating paalala sa ating mga LGU, sa mga companies at institusyon na dapat sundin ang prioritization ng grupong A1 to A3 na nandoon sa kanilang mga sinasakop. Importanteng panatilihin natin ito sa kabila ng ating simultaneous vaccination with priority group A4. Now this strategy is being supported by IATF Resolution number 117 kung saan ipinatutupad ang pagtatalaga ng fast lanes para sa pagbabakunan ng lahat ng kabilang sa A1 to A3 groups. So kasama na dito yung mga inisyatibo tulad ng no wrong door policy. So ibig sabihin, lahat ng active vaccination sites pwedeng tumanggap ng mga magpapabakuna. Pangalawa, yung A1 to A3 can be given vaccination even for vaccines procured by the national government. Pangatlo, dapat tiyakin ng mga LGU na mayroon silang kakayahang pagsabayin ang pagbabakuna ng A1 hanggang A3 bago pa nila or habang hinahanda nila ang A4 vaccination. So I know this is a very tall order for these institutions, but really, no, kung pupunta na lang tayo dun sa mas maraming A4 ang may gusto ng bakuna. Ayaw na ng A2 at A3. Bakit pa natin sila aantayin? No? Again, we have to keep in mind, hindi talaga magiging mabisa yung ating strategy kung hindi natin masuyod ng husto yung A2 and A3 bago pa natin puntahan or habang pinupuntahan natin yung A4. This might be difficult to implement. It might be a little counterintuitive to understand, but I really hope that this presentation helps us all to keep this in mind. Next, please. So, upang tiyakin ang husay ng ating mga pulisiya at inisyatibo, lalo na bilang tugon sa nakikita nating non-vaccination ng ating mga priority groups, kinakailangan na meron tayong datos na babalikan. And kailangan nating matukoy kung ang kanilang non-vaccination ay nanggagaling sa vaccine hesitancy or dahil lang sa access issues tulad ng kakulangan ng impormasyon o problema sa internet connectivity, o kahirapan sa pagpunta ng mga vaccination sites. Actually, may mga ibang bansa, even in developed country settings, na na-recognize itong mga problemang ito. And I don't know if you've been keeping up with the news early in the year where volunteer groups actually in the US in particular, volunteered to register their elderly population para hindi maging balakid or hindi maging barrier ito sa pag-access ng actual vaccine doses. So getting this act together or getting this process together and getting information on this, finding out ano ba to, hesitancy ba talaga or access, knowing this will be crucial in helping our smaller LGUs with less capacity to implement an efficient vaccination program. Kung baga, yung learnings natin dito sa mga LGUs na may mga capacity, pwede nating ibaba sa mga smaller LGUs with less capacity at matulungan natin sila kung paano maging efficient sa kanilang implementation. Kailangan din natin ng periodical evaluation ng ating mga operation upang patuloy na mapahusay ang ating mga strategiya at nagagawa ang patuloy na quality improvement para matugunan ang mga lugar na nakakaranas ng problema sa kanilang pagbabakuna. Kasama din sa mga rekomendasyon ito ang pagbibigay ng wasto at sapat na impormasyon sa lahat ng ating LGU. At syempre, para magawa ito, marahil ay dapat suriin at pagtingin din natin ang ating health promotion activities upang maabot ang mga lugar at komunidad na wala o hirap sa internet access. Finally, maigi ring tignan natin kung masyado ba tayong nakatuon sa NCR+, at kung nagiging dahilan ito kung bakit nagiging mabagal ang pagbabakuna ng ating A1 to A2. Next slide, please. Bukod sa ating mga rekomendasyon para sa ating mga LGU at ahensya ng gobyerno, nandyan din ang ating mga rekomendasyon para sa ating mga kababayan. Alalahanin natin na mayroon tayong mga interventions at paraan na matitiyak ang ating kaligtasan at importanteng sundin ito. So, hindi lang tayo dapat nakatuon sa vaccination kung hindi doon din sa ating mga proven na interventions na nakakatulong talaga sa pag-iwas ng sakit. So, importanteng sundin natin to kung talagang gusto nating marating yung normalization ng ating livelihood opportunities na mangyayari lamang kung ligtas na tayong lahat. So, bagaman natunay ang halaga ng pagbabakuna, hindi ito ang natatanging paraan. Nandiyan pa rin yung prevention, detection, isolation, tracing, reintegration or ating PDITR strategy. At dapat na talagang maigi at mahusay ang implementation nito ng mga LGUs and institutions. We have to make sure that these operations are strengthened so the targets are achieved, especially the gatekeeping indicators that are constantly being monitored, no, para makita natin yung earliest signals na nagkakaroon na tayo ng problema, or makita rin natin kung saan tayo nakaka-improve na ng gusto at pwede pang i-sustain yung mga improvements in those indicators. Nandyan din yung pagsuri ng datos, kung saan natutukoy natin ang mga lugar na dapat nating bigyan ng additional support and prioritization sa COVID-19 responses and interventions. And para naman maging ligtas ang pagbubukas ng ekonomiya, minumungkahi ang pilot implementation ng pagbubukas sa mga low-risk areas, gaya ng mga paaralan at mga pasyalan na nasa minimal community risk areas. Kasama din dito ang ating komunikasyon kung saan kailangan nating ipaalala sa lahat na hindi lamang bakuna ang tanging paraan para marating yung ating better normal. So even if we realize na ang bakuna ay makakatulong talaga sa pagsagip ng buhay, ginagamit dapat ito ng mahusay, hindi lang basta-bastang ipinamimigay sa kung sino-sino. Kung hindi, maganda dapat ang prioritization, and at the same time, sinusunod pa rin natin ang minimum public health standards para mapagtugma natin o mapagsabay natin itong mga interventions na ito at ma-maximize natin ang ating impact. Next slide, please. Okay, so with that, you let me, thank you for giving me this chance to present, and also let me turn over the floor back to Laura for the next speaker.
Maraming salamat po, Dr. Ana, and thank you for giving us a comprehensive recommendation po, list of recommendations from our experts to our LGU or local chief executives po. On that note, allow me just to recognize po some of our LCEs in the call po, So, Governor Tuban of Kalinga is here. Good morning po. Governor Mandanas of Batangas. And Governor Albano is also here of Isabela. For our mayors, we would like to greet po, Mayor Cayetano of Taguig, Mayor Modomo of Tarlac, Mayor Tabayan of Nueva Vizcaya, Mayor Tolentino of Quirino Province, Madela, Mayor Menchi Bernos of La Paz Abra, Mayor Lourdes Saguban of Reyna Mercedes Isabela, Mayor Josephine Bangsil of Luna Apayao, Mayor Evelyn Martinez, Santa Marcela Apayao, Mayor Gabino Gangangan of Sadanga Mountain Province, Mayor Clarita Limbara of Bayaba, Surigao del Sur, Mayor Grace Kimura of Madrid, Surigao del Sur, Mayor Libertad Alameda of San Agustin, Surigao del Sur, Mayor Rogelio Pimentel of Tago, Surigao del Sur, Mayor Roxanne Pimentel of Tandag, Surigao del Sur, Mayor Vic Paul Salarda of Sarangani Province. So mula Luzon hanggang Mindanao, salamat po sa pag-attend ng ating town hall today. We would also like to greet din po our participants from the Department of Health. Magandang umaga po kay Undersecretary Abdullah Dumama Jr. of our Field Implementation and Coordination Team, Visayas and Mindanao. Magandang umaga po. Magandang umaga po, Director Nika Hao at Director Aleli Sodjakat. Now, we move on to the next part of the conversation or our town hall today. Sinabi po ni Yusek Manika Inti kung gaano kaimportante na meron tayong datos. With that, I will give you our resident epidemiologist, Dr. John Wong, to give the science and the data behind our prioritization framework. Dr. John, the floor is yours.
Thank you, Laura. I'll just share my screen. Can you see my slides?
Yes, po.
Thank you. Okay, so this morning I'd just like to discuss how we can use vaccines to reduce deaths and get back to the normal. So let's find out where we are now with regards to the vaccination program. So this graph shows our three priority sectors, no? A1, A2, and A3, and the percent accomplishment or vaccination rate we have achieved, no? Relative to the size of the category. No? So for health workers, we're doing quite well. No? We vaccinated 90% of health workers. For seniors, we're only doing 14%, and for persons with comorbidities, only 8%. No? So is this a good or a bad performance? No? So we started vaccination March 1, and if we're targeting to vaccinate 70% of the population by December, no. So that means each month, no, this is 10 months, no. So each month we have to vaccinate about 7%, no. So in the 3-month period, we should have vaccinated about 21%, no. So we're doing well with health workers, but not so good, no, with seniors and persons with comorbidities, no. But before we ascribe this to, or before we say that this is due to vaccine hesitancy, we have to remember that vaccine confidence, no, which is the opposite of vaccine hesitancy, is at 32%. No? This is the SWS March survey. No? So even at these levels, we know that some of these people want the vaccine but cannot access it. No? So aside from the vaccine hesitancy issue, we also have to address access issues. So are people coming back for their second doses? So if we look at about 3 months worth of data, no, just looking at the vaccines that have a 1-month interval for vaccination, no, Sinovac and Gamaleya, no, we vaccinated 3.1, no, for first doses, 3.1 million first doses, no. So we expect about 2.1 million to have come back, no, by now, no, for their second dose, no. But so far, only about 1 million have come back, no. So maybe about half of the people who have taken their first dose are missing out on their second dose, no? So we need to follow up on these people. If we look across regions, no, we have some regions doing very well and some regions not doing so well, no. So NCR is the highest performer, no, almost at 10%. No? And then we have some regions hovering around 4%, no, CAR and Caraga, but only because they're the regions with the smallest populations, no. Also region 2, no, and maybe 11. But most of the other regions, no, are about 2 to 3%, and some are even below 2%. No? BARM is at less than 1%. No? So lately, no, the government has identified NCR +8, no, as a priority vaccination area. No? So because these are the areas with the highest number of deaths. No? But if we look at their performance of deaths versus vaccination rate, we see some regions who are prioritized in terms of supply, but have been underperforming, no, in terms of vaccination rate. No, they're not vaccinating rapidly enough, no, to maximize their increased supply. No, so in fact, there are other other regions with lower number of deaths, no, who are performing much better. What about the match between our need, no, and our supply, no? So to vaccinate 70% of the population is about 77 million, no? So we need to vaccinate about 7.7 million per month, no? So this is about 15.4 million doses, no? That's what we need per month, no? Up to December, no? This 154 million. But so far, no, this is what we have received, no? This is for June, no? This also includes the ones we expect to receive, no, by the end of the month, no? So our supply, no, has been lagging behind, no, our need. So summarizing our challenges, no, the need is great, no, as we've seen, no, but demand is lagging, no, not just because of hesitancy, but even because of access issues, no. So these are people who want to be vaccinated but cannot for one reason or another, no. And then we also see that our supply is constrained, no. So in this situation, no, what's the best thing that we can do, no? How do we maximize the impact of our vaccines? If we look at the history of our epidemic, no, in 2020, no, so these are the different age groups. The blue bars are incidence rates or infections. The red bars are mortality rates, no, or deaths. No? So we see that the working age population, no, 20 to 59, bore the brunt of the infections. No? So most of the infections are in this category, no, or A4. However, the deaths, no, are mostly in the A2 category. No? So they've been infected a little less, no, than A4, but their deaths, no, are 3 or 4 times more, no, sometimes 5 times more. So we know now that A2, no, is a high risk population, no, for death, no, due to COVID. Again, no, if we look at age groups, and if we look down to the people 50 years old and above, no, they only make up about 17% of our population, no? A very small percentage. No? But people or Filipinos 50 and above, no, make up 80% of the deaths. No? So the insight we have here is that just vaccinating 20% of the population can prevent 80% of all deaths. No? And this is not just any 20%. No? It has to be the oldest, no? Meaning starting from 50 upwards. No? So that was looking at age. No? What about if we look at priority categories? No? So again, no, the risk of death for seniors is the highest, no, at 80 deaths per 100,000. For non-elderly adults with comorbidities, it's about 15. No? Not as high, no, but still higher than the rest. But for similarly aged adults, no, without comorbidities, the risk is only 4. No, it's only 1/3 the risk of persons with comorbidities. Meaning, if you have a comorbidity like hypertension or diabetes, the risk for death triples. No? So again, we see 2 of the high risk categories. No? And these 2 categories, no, A2 and A3. Already represents, again, no, 80% of all deaths. No? So 50 and above represent 80% of all deaths, and A2 and A3 also represent 80% of all deaths. No? So this explains why seniors are prioritized, and it also explains why non-elderly adults with comorbidities are also prioritized. Again, if we look at our cutoff of 50 and compare it with the population with comorbidities, just this group, no, of 50 years and above already account for almost 60% of persons with comorbidities. So, meaning if you vaccinate 50 and above, no, you're practically vaccinating almost a little more than half, no, of A3 also. So which leads to this recommendation, no, na we vaccinate A2, which is 60 and above, but we add the category of 50 and above, no, 50 to 54 and 55 to 59. No? So if we vaccinate 50 and above, no, we prevent 80% of all deaths, and we cover 100% of A2, 30% of A3, and 15% of A4. So we hit 3 categories, no, just vaccinating 50 years old and above, and with the important impact, no, preventing 80% of deaths. So why use age to qualify vaccinees? No? I mean, we have other criteria, no, like comorbidities or being a frontline worker or essential worker, no. And these are the reasons, no. If we use age to qualify vaccinees, no, age is actually easier to verify than comorbidity, no. So, for example, in one study, they found that 60% of Filipinos with hypertension are undiagnosed, no. They didn't know that they had hypertension before the study. So persons with comorbidity, although they are at high risk, are actually quite difficult to find. No? So the person himself or herself may not even know that he has a comorbidity. No? So he or she might not even initiate to register under A3. No? Second, age is also easier to verify than employment. Okay. About 40% of our workers are in the informal sector. No? So they have no company ID to show. No? But if you start vaccinating by age, and age is much easier to verify, you're also able to qualify A4. Again, if we vaccinate by age, meaning starting with 50 years old and above and going down by 10-year age categories, we prevent the low-risk 20-somethings from being vaccinated ahead of the high-risk 70-year-olds. Okay, so I already showed. Maybe let's go back now. So this is the risk of deaths of those 70 and above. Quite high, almost 100. But for 20-year-olds, the risk of death is actually very negligible. It's very small. It can hardly be seen. So, which explains why 70-year-olds should get priority over people who are in their 20s. So, for example, in June, including the doses that will arrive, we will have 13 million doses. But we know we're using two dose regimens. It's only good for 6.5 million people. So from A1 to A4, even if we account for people who have already been vaccinated, and even if we only count people who want to get the vaccine, meaning people with high vaccine confidence, we have about 19.4 million people who want the vaccine and have not been vaccinated. They will be competing for 6.5 million complete doses. So that means there are 3 people who want to be vaccinated for each complete dose, 3:1. So this very clearly shows that we have to prioritize, and we have to prioritize according to death or risk of death. Even if we provide special lanes for A2 or A3, it's still possible that people who are in their 20s can get vaccinated ahead of people who are in their 70s. However, even if we focus just on the groups that I mentioned, 50 years old and above, and just do it by age, we actually cover a large proportion already of A4. So, for example, the 60 to 64-year-old in A2 are about 5% of the A4 population. Persons with comorbidities are about 24% of A4. And those 50 to 59 are 15% already of A4. Okay. So just using age and starting at 50 already covers A2, A3, and A4. So this is what needs to be done in order to accomplish this. First, among those who are confident in vaccines that have not been vaccinated, we have to try to diagnose what are the access issues. Is it physical availability, meaning vaccines are not available, or they've missed their second doses? Is it geographic accessibility? For example, are their vaccination sites more than an hour away from their place of residence? Is it financial affordability? All the vaccines are free, travel there, no? It's not, no? Or is it accommodation, meaning are we meeting them where they are, no? Some seniors cannot leave their homes, no? Because of physical disabilities, no? And some people, no, A3s, no, may have work, no, and cannot take a leave, no, to get vaccinated, no? Within office hours, no? And then after vaccination, no, they're usually sickly or asymptomatic, no, so they need one more day of leave, no? Second, we need to address hesitancy, no, across all groups, no? So in the same SWS survey, about 32% want the vaccine, another 32 or 33% are undecided, no? So these are people that we can convince, no, easily, no? The third step is just for 2 months, no, June and July, just focus on vaccinating those 50 years old and below, 50 years old and above, no? And I've explained why, no? Just using age as a criteria and starting from 50, we can already prevent 80% of deaths, no? And this can be just a focus of 2 months, no? And then for the rest of the year, no, vaccinate the rest of A4, no, in 10-year age groups, no, in descending order, no. So 40 and above, no, 30 and then 20. I think that's my last slide. Thank you.
Thank you very much, Dr. Wong, for your presentation. So, napakahalaga po no, that we encourage our constituents to get vaccinated, yung pangalawang dose nila. And that's what we want to harp on in the next coming weeks po. It's also very important for our vaccination sites, our LGUs, our LCEs, to look at what are the things hampering, no, our potential vaccine recipients from getting vaccinated. So is it an issue of vaccine hesitancy, or is it an operational issue ba siya of access? With that, we move on po to our next presenters. Kaya lang, gusto ko lang din pong batiin si Dr. Nina Castillo Carandang, one of our health experts. She's in the call. I would also like to greet Mayor Evelio Leonardia of Bacolod City and the National President of the League of Cities of the Philippines, and Mayor Nestor Bersamina of Lacub Abra. With that, I will give you Yusek Kaintik, Emmanuel Ray Kaintik, to give us an idea of the interoperability and updates of the COVID-19 vaccine management system and immunization registry. Yusek.
Magandang umaga sa inyong lahat ulit. So, we will have two parts of this presentation on the DICT. Ako muna yung mag-umpisa on explaining ano yung efforts natin for DOH, no? Ang ating mga kasama sa DOH on the vaccine information system. At ano yung mga ginagawa natin, as well as yung mga datos na kailangan natin ikalap para maging matiwasay yung ating pagbabakuna. So I'll share a slide, my slides. Okay. Can you see my slide? Okay. Can you see my slides, Laura?
Yes po, we're able to see it. Thank you.
To understand, no, yung bilin sa atin ng IATF is gawin ang Vaccine Information Management System. Hindi po siya isang application, mobile app, or hindi siya yung parang isang software lang na gamit. I-breakdown ko into 3 parts yung ating efforts. Katuwang ang ating mga kasama sa DOH and DILG. Ang pinaka-importante is yung data acquisition and enabling systems. Meron po tayong ginawang system para makuha yung master list, yung sinasabi kanina ni Dr. Ong, ni Yusek Rosette, and ni na kailangan nating makuha yung mga listahan ng mga candidate na mga babakunahan pa lang in accordance to priority list. I cannot emphasize anymore the importance. Kanina mga speakers natin have emphasized already that we have to prioritize so that it will be most effective to achieve herd immunity the soonest possible time. From a data perspective and from a systems perspective, makikita niyo mamaya na malaking, I think si San Juan and other LGUs who have instituted a pre-registration system. Not only were they able to understand and estimate their demand at natulungan ang NVOC, ang National Vaccine Operation Center sa pagplano ng demand, nakatulong din yan, makakatulong din yan sa pagiging matiwasay na pagbabakuna. Tapos, meron din tayo isa pang system para kunin ang mga line list. Line list, meaning to say yung buong listahan ng datos para dun sa taong nabakunahan. Mamaya, ang aking colleague, si Christian Chua, will explain to our friends in the LGUs ano talaga yung mga fields na important, lalo na dito sa line list. Meron din tayong systems na pinadali na natin talaga for quick counts. Bakit may quick count pa rin ba't hindi na lang ipadala ang line list? Kasi ini-expect natin na yung line list, meron dapat paglinis konti, ayusin naman ang datos. Kasi kung, ang sabi nga, garbage in, garbage out. Pero yung quick counts, important siya kasi yun yung plano, yun yung ginagamit naming datos every day, mamaya explain ko, to understand the demand and supply planning every single day for every LGU. Nagsimula na po for the past 3 weeks ang ating daily vaccine rollout huddle, pero nakatutok muna kami sa NCR plus 8. Pangatlo, another system is yung mamaya i-explain ko a bit, yung Vaccine Administration System or DVAS. Hinihikayat natin ang mga LGUs na kung wala kayong sistema, huwag na kayong mag-atubiling gamitin ito. For the LGUs that are fortunate enough to have been able to purchase their own vaccination administration systems, kudos to you kasi hindi nyo hinintay na magkaroon pa. But we needed to build this because marami pa po tayong babakunahan as we are going to the next few months as the surge of the vaccines will come. At kung hindi kayo gagamit ng system, mabibilaukan kayo sa pagbabakuna on the ground. Our bold estimate is that you need to be able to complete a vaccination routine for less than 10 minutes in order for us to hit 1 million a month of 1 million a week yata of vaccination. So the faster we can vaccinate. Para makauwi din itong mga LGUs na nandito, pag gumamit kayo ng matiwasay na system, pagdating ng alas 3, alas 4, papahinga na kayo dahil ang datos umaakyat na diretso sa national. Malaking bagay yan so you can resume the following day's operation na hindi kayo hapo. Sa national level at sa regional level, we are providing a dashboard and all the decision support systems for our National Vaccination Operations Command or Center. And we will also provide these decision support soon to the regionals. Pero nasa national muna ngayon ang tutok kasi nandito ang ating central planning. Kasama dito yung ating integrated inventory tracking and replenishment information system. Ginagather natin ang mga datos galing sa ating mga third-party logistic partners para isahang view makikita natin ang mga level ng mga inventory of our warehouses pati doon sa ating mga bakuna centers. And lastly, the DICT is providing technical IT support for NVOC, RVOC, as well as yung mga bakuna centers. I will spend a few minutes discussing the DVAS. Ito po yung Vaccination Administration System na gagamitin sana ninyo sa inyong mga bakuna centers. Bakit maganda mayroon ganito? Una, meron na rin siyang self-registration. Pwede kayong ito na ang gamitin yung self-registration system kung wala kayo. Now, kung meron na kayo na umpisahan, huwag kayong matakot. Yung self-registration system nyo, ituloy nyo lang, i-upload nyo lang. Ang bakit kailangan i-upload ang mga self-registration o yung registration para sa queuing nyo? Para pag-upo ng tao dun sa bakuna center, nandun na ang datos niya. Kaya natin i-integrate. Pangalawa, may registrar function. So, importante dito, kung gumagamit kay DBAS, pag upo pa lang ng tao, yung registrar, yung unang kausap ng magbabakunahan, nandun na ang datos niya. Nandun na rin ang vital signs entry, health screening, inoculation, hanggang dun sa pagbabakuna. So, we have done many time and motion studies. Gamit na po siya na San Juan, Pasay, at niro-roll out na po natin sa marami pang lugar. So, kasama na dito yung inventory tracking. So, pag nagbawas ka sa iyong stock, automatic nang ibabawas sa iyong stock and stock inventory. At ang pinaka-importante, yung line list data na sabi ko nga kanina, importante kasi as we are moving towards the passports, kailangan ko talaga yung datos para mabigyan ko ng sapat, magbibigyan kami ng sapat na impormasyon tungkol sa nabakunahan, kailan siya nabakunahan, ano yung ibinakuna sa kanya para magawa yung kanyang vaccine certificate. But let us talk about that some other time. I can answer questions later on that dahil wala pa nga tayong tamang polisiya on the issuance as well as the usage. Pero magkakaroon. The other part is that, as I said earlier, kung gumamit ka ng DBAS or gumamit kayo ng vaccine administration system, ang kailangan yung hanapin, bumilis pa yung buong proseso. Hindi dapat ang iyong vaccination administration system isa siyang pabigat doon sa mismong pagbabakuna. Hindi dapat tumagal. Kailangan mabilis ang daloy. Para dapat siyang production line. Pangalawa, importante yon kasi araw-araw tayong magbabakuna or every other day. Hindi pwedeng mapagod ang ating mga vaccination teams. Gusto natin, pagdating ng alas 3, alas 4, they can pack up and leave or do other things. Marami po sa atin dito sa mga LGUs, I understand. Kayo din po ang nagbabantay ng inyong mga quarantine centers, quarantine facilities. Kayo din po ang nasa contact tracing at lahat. Importante po na dahil nagdo-double duty tayo lahat, you can reserve your energy for the following day dahil you have to keep on vaccinating. And then pangatlo, importante na may sistema like the DBAS that we are highlighting para mabawasan ang mali-maling pagpasok ng datos. So bibigyan ko lang kayo ng mga previews ng screens. So gamit natin ang DBAS, yung entry. Na dito pag nakikita mo, pag ikay nakaupo na doon sa registrar, yung unang taong kausap mo nagbabakuna na itinatanong kung ano yung datos mo, pag naka-pre-register ka, nandun na kaagad yung datos mo. Nandun na. I-validate na lang actually, parang attendance checking na lang siya. Sa screening, mas mabilis din. Yes, yes, no, no. Mas mabilis din ang pag-track ng digital consent. Kailangan po natin ito kasi ang iniiwasan natin is hindi naging maayos ang ating pagkuha, no? Pag-oo ng tao sa kanyang pagbabakuna, pagpapabakuna. Dito rin sa DBAS, mabilis na lang po niyong makikita ang mga reports. Pwede niyong i-download para sa inyong tracking as LGUs. Pang-apat, sabi ko nga kanina, kung gumamit kayo dito, automatically napapadala na sa central NGOC ang datos. Ito ang medyo mabigat. Tinanong kami kung paano natin ito maro-roll out. Conservative estimate is September 2021. Paano natin ito mapapabilis? Sa mga kaibigan nating LGU, ang malaking tulong nyo sa atin dito sa Vaccination Command is mag-supply kayo ng tao, sapat na IT teams sa bawat LGU nyo. Meron kayong mga ICT councils, kung meron, itap ninyo. Kung meron kayong mga eskwelahan ng ng mga nag-aaral ng IT or computers, itap nyo na. Malaking bagay pag may IT team na maayos ang isang LGU. Kasi kung ganon, ang tuturuan natin is yung IT. So, mapapaiksi natin ito at kailangan to umiksi para mas marami ang pwedeng gumamit. Kung hindi, babagsak kayo sa dimano na paggagawa ng pag-record ng bakuna. At sabi ko nga kanina, kung hindi nyo gagamitan ng maayos na system, subject to a lot of errors at alas 8, alas 9 na ng gabi, nag-i-encode pa kayo at ipapadala nyo pa lang yun. So, we would like to help. You would like to seek your help in online IT support. Hindi natin kayang bigyan ng IT support each and every bakuna center. We are looking at about 6,000. But I think the Pareto principle here is about 2,000. So in 12 weeks time, dapat 80% of where the vaccinations will happen should already be covered. So pinapareto principle namin to, yung 80-20 rule na sinasabi. Kung mapapansin nyo, actually today, kasalukuyan, mayroong nangyayaring DBAS Roadshow. I believe the city of Makati is there, baka wala sila dito. And a lot of other cities na kahit may system na tinitingnan nila yung ating sistema kasi kailangan nga nila na mas bumilis pa. Ito rin po ang gagamitin sa mga mega vaccine sites. Sa mga SM, sa mga Green Hills, dito din po nila gagamitin. Now, we are very optimistic that in 5 days time, pag umpisa ng pag-roadshow sa pagturo, kailangan live ka na. Kaya mo na. Ang challenge siguro dito is kagamitan. Kasama din po dito sa roadshow, isabihin mo kung kailangan mo ng tulong sa gamit. No promises, maghahanap ako. Maghahanap kami, maghahanap ang DICT ng paraan kung paano kayo matulungan sa kagamitan. Marami tayong tinatap na mga foreign aid on it para makatulong. At sana din, parang yung multiplication of loaves. Kung meron naman kayong computer, gamitin nyo na. Kasi hindi naman siya ganun ka-intensive sa computer needs. Pero internet, bibigyan namin kayo. Kung wala talagang internet, lalagyan namin ng internet. Sige, bibigay ko na ngayon ang floor kay Christian Chua, who will talk about the data requirements. Kasi in the end, may system ka o wala, datos ang kailangan namin sa iyo. Christian, thank you.
Thank you, Yusek. For a moment.
Are you able to share? Can you check?
Yes, Yusek, I'm able to share. Okay. I'll start first with about the line list. The line list is the main data requirement during the vaccination event. Okay, so there are two kinds of data requirements. One is the master list and the other one is line list. Yung master list po, when you do yung registration, the information in your registration will be contained in the master list. Okay, ang idea po ng master list is this gives an indicator how many po ang target group natin per priority category. How many po ang nasa A1, how many po nasa A2, etc. While during the vaccination event, pagdating niyo po sa vaccination site, and where different information are collected from you, this information are very important to be in the line list. Okay, so if you look at the information on the line list, this is a total of this is around 27 data columns. Originally, it was 46, but we heard po yung feedback from the ground, and we tried working together with DOH to narrow it down to 27 data columns. Okay, you can see the information here. It includes the profile of the person name, first name, last name, middle name, contact information, contact number, and address. It also includes here, you will see on the top line, second column, unique person ID. What we are referring to here is yung ID, unique ID na ginamit po ng LGU to record the information about that individual. So in other LGU, they create a unique ID for the COVID vaccination program. We want that ID number. The reason for that is because this will be the primary attribute that we will use to connect yung first dose and second dose of the person. Okay. In the next line, it contains further the profile of the person, gender, birth date, and two important information na hindi po dapat natin kalimutan. When a person goes in the vaccination center, may screening po, and in case there will be a positive in one of the screening criteria, then that person will be subject to deferral. Okay, so applying it to this template, reason for deferral, yes. Deferral, yes. Reason for deferral, there are particular codes for each deferral condition. Okay, but very important for the LGU, per brand po of vaccine, may sarili po siyang screening form. Okay, what we did here lang po is we took a look at the different screening form and categorized them into a general code. Para pag-enter po for data management, we're just encoding deferral 01, deferral 02, deferral 03. Okay, but when you do yung screening po in the ground, use the screening forms po of DOH. Okay, then after that, we now have yung information about the vaccination event, vaccination date, vaccination name, batch and lot number, bakuna center ID, and vaccinator name. Okay, very important po, wag po kalimutan yung batch or lot number. The reason for that is pag nagkaroon ng adverse effect condition, our DOH case or tracing, baka may kinalaman po for that particular batch of the vaccine brand. Okay. Then on the third line, you have the vaccinator name, you have first dose and second dose, then adverse event and adverse event condition. Yung adverse event and adverse event condition here refers to the adverse event that happened in the vaccination site. So yung adverse event po that happened outside of the vaccination site, that is captured by another system called VGFlow. Okay, so these are the 27 data columns. We will be very strict in the completeness and accuracy of this information because this will be the primary source po of information for our vaccine passport. It is now the responsibility po of three parties, the ICT, LGU, and the vaccinee or the Filipino. Okay, we need to work together to make sure that information here are complete and accurate. Okay, kawawa naman po later, pag let's say ang information na miss is walang vaccine brand or walang vaccine batch or lot number, then the Filipino is applying for a vaccine certificate, then we cannot immediately issue that vaccine certificate. It has to undergo a longer process to verify that that Filipino had completed his or her vaccination. Okay po? Okay. Now, with this information that we are collecting from you, so we have information at the line list level, very detailed, up to the Filipino name, up to the barangay level. We also have information coming from the daily count. Okay. On a data manager point of view, we simplified it. Okay, on daily count natin is NAMFREL. Every day, we just want to know the total vaccination of the bakuna center, and they need that to submit that information kahit 12 midnight pa nagsara ang bakuna center. On the other hand, the line list naman is like our COMELEC, our single source of truth. Ideally, it should be submitted daily, but sometimes vaccination centers are operating beyond 9 p.m. So we give them a leeway of a few hours, but not more than a day. Okay? So with this information that we collect, we are now able to give the public a national and regional view about what's the condition and situation of our vaccination program. You can see this in the public dashboard that right now we have already administered 5.2 million. With regard to the number of Filipinos with at least one dose, we have already covered 5.71%. The number of Filipinos with two doses, we have already covered 1.77%. Okay. In addition to that, for the LGUs who has been our partners and our CHD from DOH, our partners since day one of this vaccination program, the data that we collect to you, we are now applying it in a performance-based vaccine allocation model. Okay, This performance-based vaccine allocation model is we measure and monitor each of the LGU, how much was their performance yesterday, and we compared it against the target. Okay, for those LGUs that are exceeding their targets conceptually, if there's an enough supply, then they are given more allocation. Okay, for those who are not meeting their targets, it's not we are penalizing this LGU. We are knowing about the ground situation of that LGU, and national is ready to support whatever needs of that LGU. Maybe it's about auxiliary supplies for the vaccination program like syringes, or maybe it's about what Yusek Mani mentioned earlier, internet connectivity. That's why the data are not submitted on time. So this data that we collect, we present it in this form to understand the situation, and for the national and the other partners be ready to help each of the particular LGU nationwide. Okay. We also take a look at the inventory levels, because we always worry na may mag-expire na inventory and hindi sayang po. We hate sayang at this daily meeting with Sec Charlie, Sec Dison, with the NBOC headed by Yusek Nirna, and with the other stakeholders. We hate sayang, okay? And we always want na every day Bakuna centers will be open to finish the first doses, but for the next batches, we will use it for the second doses. Okay. And for the LGU, since we are now, the NVOC has issued an advisory that the LGU is the primary data aggregator of any vaccination events happening in their jurisdiction. So even if the vaccination was by the private sector, using their own vaccine, the ones they procured, the information here has to be submitted to the LGU. Okay, we are continuously helping the LGU to simplify and lighten their load in terms of data capture. So this is a look of the daily report. This is actually the daily report portal where we ask the LGU to submit a summary and aggregate information about their vaccination during the day. Okay, as you can see here, the LGU will just need to encode for a particular Bakuna center with less than 8 information fields to be able to determine the daily target, the daily vaccination count of the LGU. For the inventory end, it has around 5 information requirements. And for the capacity, we would like to know if the LGU has enough capacity to do more vaccination. This is how they report the information. So far, with the streamlining of limiting ourselves to necessary information for the daily count, LGUs are improving the submission of this information. And again, anything the ICT, the whole of government, or together with our private sector partners, we are ready to help the LGU to be able to submit data, or more importantly, to be able to do and hit their targets with regard to the daily vaccination. Okay, that's all for our presentation. Yusek Mani.
Thank you, Christian. Thank you so much for the exposition, and we will entertain questions later, but maybe not all, because there are information that we are not yet granted public answer publicly at this point, as we are managing communications in sync with the NBOC. Thank you so much.
Thank you po. Thank you po, Yusek Mani, and thank you. Now we go to how our LGUs naman po, one of our representatives from our LGUs will be discussing how they are accelerating local vaccination process, at the same time still being able to prioritize A1 to A3. With that, I will give you the representative of Mayor Zamora, Mr. Brian M. Jelly, from the he is the Chief City Information Officer. So, Mr. Jelly, the floor is yours.
Good morning. Good morning, everyone. Good morning, Yusik Berheri, Yusik Intik, the other USIC's ASEX directors of the DOH, the ICT, the ILG, and other offices of our government. A shout out to my kababayans in Surigao del Sur, madayaw na buntag sa iyo tanan. Please allow me to present to you the best practices of San Juan City. Mayor Francis Zamora has asked me to present it to you on his behalf. Okay. So first, let me begin by presenting to you the COVID-19 update, bed capacity, registration, and vaccination of San Juan City. At the moment, we have 145 active cases. That's down from 1,226 last April 14, which was our highest since the pandemic started. And we have 8,639 recoveries. And unfortunately, we have 212 deaths. The bed occupancy of San Juan City for San Juan City Medical Center, it's 57.3%. Kalinga Center is 14.4%. San Juan National High School is 2.7%. And Bahay Kaagapay, our modular container vans facility, it's our newest one, built by the DPWH, it's 49%. The total registrants of San Juan City as of June 1, 6 p.m. is 81,142. That's about 95.01% of our target population, which is 85,400, which is 70% of our total population of 122,000. So it is high, and we're very happy with our vaccine acceptance rate. 95% is very high, and we are still working hard to make this 100% of our target, and in fact 100% of our population. This is our current latest vaccination report. As of June 1, 2021, we have administered a total of 29,050 first doses and 10,752 second doses. Our first doses is about 34.02% of our target population, and the second dose is about 12.59% of our target population. So we are also very happy with our numbers. But if you can see, and if you notice, our first dose and second dose per the day are quite low. That's because we have already reached, we've already vaccinated all those who have qualified in our A1, A2, A3 categories. So for our best practices, how were we able to vaccinate over 34% of our target population in less than 3 months? So one is early preparations, budget allotment of 50 million for our vaccine was done October 5, 2020, when the City Council passed Ordinance number 75 series of 2020, and it was immediately signed by Mayor Francis. So January 4, we already started our registration. We opened our registration portal and had everyone start registration on our links. We had posted our link. We posted our links and the QR codes. And then after some changes, we had a new one. We call this the Bakuna Flex. So you can scan the QR code or just follow the link, and then that will lead you to our registration portal. San Juan City residents and other qualified citizens may register at the San Juan City online portal, and those who do not know how to access the registration online or do not have gadgets or internet may seek help from their barangays. But as you all know, we have free Wi-Fi all over the city, care of DI-City, since we are the pilot city for the Smart City and Wi-Fi for All program of the DI-City. Early preparations, we've had lots of practice. San Juan City conducted weekly vaccination simulation in the months of January and February 2021 to familiarize the city's vaccination teams with process and to identify bottleneck areas and resolve them prior to the actual rollout. In fact, for some time we kind of felt there was a lot of repetition in our simulation. But in hindsight, it was actually very effective because we were able to identify all the problematic areas. So practice does make perfect, hopefully, but right now we're better and we're hoping for best. Vaccine awareness, we've conducted several. San Juan City conducted a training for vaccine awareness for our department heads, barangay officials, teachers, and private sector representatives. And we've also conducted house-to-house, on-ground house-to-house vaccine awareness campaign and registration. On February 9, we launched that, led by Mayor Francis Zamora. And we went to all our barangays and we've been doing the rounds. We just stopped it. We paused it during the ECQ, but we have resumed our on-ground house-to-house registration. This is very effective. Just so you know, this is really effective, especially when we send people who have been vaccinated and they see that these people are okay. So those who have hesitated usually sign up and get vaccinated later. So this is the on-ground house-to-house vaccine awareness campaign and registration is very effective for San Juan City. And then we also conducted several town halls. We had Mayor Zamora, and then we had several experts from the San Juan Medical Center and Cardinal Santos Medical Center discuss developments against COVID-19, the vaccines. We've searched them out, we've examined them, and we explained them to our constituents. And then another key to a really fast and vaccination process is an efficient system. So let me explain this to you. When we started, we were doing manual processes, and it took 20 minutes per person. So we started with A1, San Juan Medical Center, and then after that, we took in A2 and A3. So from registration to vaccination, it took us around 20 minutes, and then another 15 to 30 minutes for the post-vaccination monitoring. To make it even more convenient for us, we moved our freezers, the 2 to 8 degrees Celsius, and our ultra-low freezers, the negative 80 degrees Celsius. We moved them inside our vaccination center. So it's on site to avoid vaccine wastage, problems with transportation. It became really convenient. So we converted 2 dugouts of the San Juan Arena or the Phil Oil Flying Center into our storage area for our ultra low and our freezers. This is really convenient if you want to do this. To make sure it is monitored 24/7 by the PNP SWAT, the CHO, the Public Order and Safety Office, and the TPMO. They make sure every hour we check the temperature. We make sure our ultra low freezers do not go higher than negative 80. And then we also have another ultra low for Gamaleya. It's on standby. And then we have several of those 2 to 8 degrees Celsius refrigerators for the other vaccines. So we were able to cut our process by half from 20 minutes to just 10 minutes, thanks to the DICT with the Vaccine Information Management System. That's what the first program was. The VIMS IR, we had that on April 13, 2021. San Juan City was actually the pilot city for this. So from 20 minutes, we were able to cut down the process to 10 minutes, half. So this really helped us. Thank you so much, DICT and Yusik Mani. Yusik Mani himself was the one who presented it, and they conducted trainings to our team. So now we actually have the upgraded system, the DIVAS. The DICT has been very proactive in upgrading the system based on comments from the San Juan City team. So the interface, dashboard, and other operability were often upgraded to make the system even more user-friendly. So that's also something that we thank the DICT for. They're always on standby. They always send people to us so that when we have suggestions, they're able to upgrade the system immediately. And then we already had our vaccine registration portal, But when the government said that we may be able to start vaccinating A4 soon, we upgraded our vaccination registry to have special links for San Juan residents and another for non-residents working in San Juan City, so that we are able to accommodate everyone. This is our own, but we didn't actually spend a lot of money for this. This is free. You actually get a lot of free programs on the internet. So we got this for free. The only thing that we paid for is the security feature, the security certificate, and the bit link. But otherwise, if you use the registration system of the DICT, which we are already thinking of migrating into, it will be even more convenient for you. What we do here is once we have the data, we just download it from our server, and then we upload it into the server of the DICT, which is really convenient and fast. So if you have your own system, you may continue to use that. But if you want to use the DICT system, that will be even more convenient for you. As of May 27, 2021, San Juan City has already texted and scheduled all registrants under A1, A2, and A3 categories. All registrants willing to be vaccinated have been vaccinated. The city government has asked those who claim to have registered but have not yet been texted to re-register so we can schedule the vaccination ASAP. Barangays were also tasked to conduct more house toss visits to convince those who hesitate to be finally vaccinated. So last week, we actually finished our list already, our master list. So what we did was we sent out all our barangays to go another house to house, convince more people. So every day we get an additional 400 to 500 people to vaccinate. That's why our performance has been dropping, because we actually ran out of people to vaccinate in San Juan City. So we're already waiting for A4 to be allowed to get the vaccine so that we can continue with our process. And masayang kasi yung aming ginagawa. We have this really big arena. We have 2 centers, and konti lang yung nababakunahan namin because we've already ran out of people to vaccinate. So as per Philippine Statistics Authority released on December 13, 2019, there are around 10,256 senior citizens in San Juan City. The city's Office of Senior Citizens Affairs, on the other hand, has just over 8,000 registered seniors. San Juan City has already administered first doses to 9,017 seniors. So that's already over the list of our OSCA, and just a few about 1,000 short from the number given by the Philippine Statistics Authority. In fact, the 9,017 is already 87.92% of the A2 population based on the PSA data, and it's 75.14% of our A2 population based on the 12,000 that we estimated. Definitely, it's over the 8,000 figure of our OSCA. So remaining seniors in the master list have been texted multiple times, with some finally getting vaccinated after being traced by the city government and the barangays. So unfortunately, some of these seniors registered their landline number, so they were able to get the texts for their schedule. So that's why we sent out our people at the barangay level so that we can trace our seniors and other people who have mistakenly inputted their a wrong phone number. So another is the helping hand that we received. This is a huge help to us here in San Juan City. We called for medical volunteers because San Juan has only about 9 or 10 doctors and a few nurses. So, but we wanted to put up this really big vaccination center where we can actually vaccinate a lot of people at the same time to be more efficient and fast. And so we called for volunteers, and fortunately, a lot of doctors and nurses answered our call. So every day we get a lot of volunteers, but we still welcome more volunteers so that we can still vaccinate more people, especially when we open our vaccination centers to A4. We also partnered with different hospitals. They also send us volunteers for free to further augment our members. We've spoken with San Juan Medical Center and Cardinal Santos Medical Center. So both have been sending us doctors. And then we also spoke with St. Luke's and UERM, that's UERMMC, the Ramon Magsaysay Medical Center. And they've also committed, both St. Luke's and UERM have committed to send us more medical workers and volunteers. So once we open our centers to A4, we will have more doctors and nurses to screen and vaccinate our vaccinees. And then we would also like to thank the IATF, the NTF, DOH, the ICT, and the DILG. They've been really helpful and instrumental in the city's fast and efficient vaccination rollout. And of course, the PNP and the BFP, because they also sent an augmentation to our security, marshals, and of course, vaccinators. Their doctors and nurses have become our screeners and vaccinators as well. And of course, we have free internet. This has made it really easy for us, thanks to the DICT, which provided free internet connection to Phil Oil Flying V Center, the city's main vaccination center. And our public spaces in the city also have free Wi-Fi from the Department of Information and Communications Technology. In fact, all public spaces and all barangay halls, and including our market and our city hall, have free Wi-Fi thanks to the DICT. So this has made the registration really easy and fast to our constituents and to our vaccination center as well. Of course, we also partnered with Converge ICT Solutions, and they've installed free fiber optic internet and free Wi-Fi connection to the city's 2 vaccination centers, the Phil Oil Flying V Center and the Theater Mall in Green Hills Mall. This is part of their CSR in San Juan City. So this is also for free. Another thing that we get for free, the Phil Oil Flying V Center, San Juan City's main vaccination center, is the Phil Oil Flying V Center. It caters to San Juan City's residents who belong in the prioritization categories already allowed by the IATF for vaccination. The 4,000-seater arena can cater to around 2,000 to 2,500 vaccinees per day. 2 of the dugouts serve as the city's vaccine storage facility. And San Juan City owns the facility but has a lease agreement with Phil Oil Flying V Center. And the city has been allowed to use the arena and all its facilities free of charge. So we thank the Phil Oil Flying V Center for this. And also Ortigas Land Corp and the Music Museum Group Incorporated. So we are ready for A4, San Juan City, in partnership with Green Hills Mall and the Music Museum Group, set up Theater Mall Cinemas 1 and 2 in Green Hills Mall as the second vaccination center of the city. This was opened formally in June 1, 2021 for San Juan City residents belonging to A1, A2, A3 categories, but we will ultimately cater exclusively to A4 non-residents who work in San Juan City. San Juan City is allowed to use the facilities of the mall for free. So thank you so much to Ortigas Land Corporation and the Music Museum Group. They've been very helpful. And of course, another thing that has helped us be efficient and fast is our social mobilization. We have Executive Order number 81, which encourages all employees of business establishments allowed to operate in San Juan City to get vaccinated. This includes even those who are non-residents but are working in San Juan City as stipulated in the IATF set guidelines and priority group categorization. Establishments with 100% vaccination workforce get a special seal from the city so that people know that that establishment, yung lahat ng empleyado sa establishmento ay bakunado at protektado. That's our campaign, vaccination campaign team in San Juan City. Ako ay San Juaneño, bakunado at protektado. And of course, we also have Executive Order number 82, issued by Mayor Francis Zamora, which encourages businesses in San Juan City allowed to operate under GCQ to provide incentives and or discounts to vaccinated customers. This encourages more people to get vaccinated and hopefully drive more customers to San Juan City businesses. So we also have the certificate, and we post the certificate on their inconspicuous areas of the restaurants or the establishments. And when you see the VIP logo, it means it's a member of the Vaccination Incentive Program, and they have special privileges to those who have been vaccinated. So kahit hindi po taga San Juan, if you got your first dose already, that's fine. You can go to any of our stores who have participated in the VIP program, and you will get a discount or you get special treats from our San Juan City businesses and establishments. Of course, we still do a lot of social media posts. We have the Bakuna Flex. We have frequently asked questions. We also have Facebook profiles, picture frames to encourage more people to vaccinate and to post it online and in their social media, so people get to know that their friends have already been vaccinated and are actually safe and alive. And of course, we have a lot of tarpaulins. Even our Valentine's Day and other tarpaulins have been designed to include the QR codes of a registration system, a registration program, so that people see and are reminded constantly that they have to register and get vaccinated. And we have electronic billboards installed all over the city. And so we also have our QR codes and our Bakuna Flex and our other programs. Of course, we highlight that the vaccines that we use are safe, ligtas, epektibo, masusing pinag-aralan, aprobado ng mga eksperto, pasado sa DFA, and subok sa ibang bansa. And then, of course, aside from the billboards, we also have a lot of social media videos that we post. One of these is this one.
Narito po ang sagot sa inyong tanong tungkol sa ating programa sa pagbabakuna kontra COVID-19. Ligtas at epektibo ba ang bakuna sa COVID-19? Opo, sinisigurado ng Food and Drug Administration na tanging ang mga bakunang may emergency use authorization o full approval ay garantisadong ligtas at epektibo laban sa pagkakaroon ng malubhang COVID-19. Ngayong may pandemya, magpapabakuna rin ako laban sa COVID-19 dahil ako'y Sanjuanenyo, bakunado at protektado. Magpalista na sa ating COVID-19 vaccination program. Magpa-register sa inyong barangay o i-type ang link na ito o i-scan ang QR code para sa ating online registration.
And of course, we have on-ground campaigns. Unfortunately, I think we have a typhoon tomorrow, so I'm not sure if we're going to push with this. We may have to delay this for a few days. The Bicicleta para sa Bakuna World Bicycle Day is tomorrow, June 3. So we also have the QR code for the registration in our vaccination program. And then we also have the QR code to check, so people can check whether they've successfully registered and they're in the registry. So in all our activities in San Juan City, we make sure we include our QR codes and our links so that people are constantly reminded to get vaccinated, to register. That's why, that's the, I guess, one of the reasons why we have very high vaccination rate and a very high registration rate in San Juan City. And we also have leafletting. We distribute this to our constituents. We have the virtual town halls. And of course, we have a lot of media briefings and interviews. If they see that our mayor is working really hard to make sure that everyone gets the vaccine that they need, that we all need, then it adds to our vaccine confidence. So that's it from us here in San Juan City. Thank you so much, everyone, for listening and for giving us the time to share with you our best practices.
Thank you very much, Mr. Jelly. In the interest of time, napakaganda po ng mga naging diskusyon ng ating mga resource persons ngayong umagang ito. In the interest of time, I will lump together na po yung mga tanong with common themes, no? And also, some of the questions raised din po, sasagutin na namin sa Facebook, sa Twitter, at saka sa YouTube, and the questions of our media partners in a more detailed briefing with Yusek Berhere. So first, maybe the question would be best for Dr. Ana kasi po, marami pa rin, Dr. Ana, nagtatanong kung sila daw ba ay may nagdadialysis or sila po ba ay tinamaan na ng COVID-19, gumaling na po sila. Kailangan pa rin po ba nilang magpabakuna?
Laura, the questions that are being raised are quite valid, no? Kasi alam natin na nag-roll out tayo ng bakuna at about the same time na nag-surge tayo. So marami either natamaan after nabigyan sila ng first dose or right before they receive their first dose. So the answer there is yes. Kahit na nagkaroon ka na ng COVID, kailangan mo pa rin magpabakuna. Alam natin na matapos tayo magkasakit ng COVID, nagkakaroon tayo ng proteksyon in the form of antibodies. Kaso ang problema, hindi natin alam kung gaano tatagal mananatili ito sa katawan natin. So by receiving a vaccine, napapataas pa natin lalo ang level ng antibodies o panlaban na meron ng ating katawan at napatatagal natin ang kanyang buhay no sa katawan natin. So kumbaga ang translation nito is magkakaroon tayo ng karagdagang proteksyon. So yes, please be vaccinated kahit nagkaroon ka na ng COVID at nag-recover ka na from this illness.
Maraming salamat po, Doktora Ana. Yung mga tanong po ng ating Facebook users would be more on the access to vaccination sites. And I'd like to recognize din po Governor Dax who just joined the call. If Governor Dax would like to also answer issues on access to vaccination sites. Saan po ba pwedeng magparehistro? Saan po kaya pwedeng magpabakuna? At saan po, may bayad po ba ang bakuna? Governor Dax, do you want to weigh in? Or maybe San Juan City?
For San Juan City, you can just, we've posted a lot of tarpaulin all over the city and on social media. You can just scan our QR code and follow the link, tag the link, and then you can already register. And for our vaccination center, our main vaccination center for San Juan residents is the PhilOil Flying V Center near the City Hall. And then for non-residents, once we open A4, it will be at the Green Hills Mall. So it's very convenient for everyone. And then wala pong bayad ang bakuna. That's something that we have to stress and to tell people. You don't even have to skip the line because sa San Juan City, wala pong line ang bakuna dahil mabilis po ang process thanks to the DOH, the DICT, the DILG. They've helped us improve our system. And so ngayon po nga, like I said, ubus na yung mga binabakunahan namin sa San Juan City. At kailangan pa po namin ng mas maraming babakunahan. Kaya you don't need to pay. It's free. The national government has provided it to us for free, and WHO COVAX facility has provided it for us for free. Thank you.
Thank you so much po, Governor Dax.
Hi, Dara. Could you kindly repeat? Sorry, I'm mobile. Medyo internet.
Okay lang po. Governor Dax, yung mga tanong lang po nila is what are the LGUs doing daw po to ensure there is access to the vaccination sites? Ano po yung inyong instruction sa mga gustong magparehistro at paano po natin i-ensure that the online registration is facilitated po even for those who do not have access to computers and internet?
Thank you. If I may share our experience here in Quirino, medyo iba kasi from the urban setting. Marami kaming lugar na walang internet at connectivity. As you can imagine, maybe most provinces have areas like that, mga isla, mga bundok, very different from the Metro Manila setting. So talagang nagkakaroon ng manual coordination with the barangay officials, and the barangay officials or the BHERDs coordinate with the RHUs, the rural health units, no? With the mayors and the doctors ng barangay. And then from the RHUs, yung RHUs po nag-ano ng vaccination post. So here in Quirino, what we did, yung barangay is tasked to ferry, meron naman silang barangay to the vaccination post. And wala rin bayad po ito, municipal government and provincial government. Meron kaming third-party solution there. So we use the Easy Box. Mga kababayan namin na may answer the question.
Yes, Governor Dax. So I guess para po sa mga constituents natin na gustong magpabakuna at magparehistro, ang LGU po ninyo may kanya-kanya po yung paraan kung paano po tayo pwedeng magparehistro. On that note, for USEC Kaintik po, may iba't ibang registration systems ang LGUs, no? Kaya na po nang nabanggit ni Governor Dax, like Easy Consult for QC and Quirino Province and self-made systems sa Manila, as well as yung mga integrated tracing in Pasig. paano po sila mai-integrate ito sa isang truly national registration system para ma-assure na yung nabakunahan ay makakakuha ng vaccine certificate or passport? Yusek Manny?
Yusek, you are on mute po.
Laura, yung yung registration para mabakunahan ka, okay lang na may iba-iba. Ang importante is yung line list nung nabakunahan na ipapadala talaga ng mga CHTs to the BIMS. So, ulitin ko lang. Like for example, kay Governor Dax, meron silang EasyVax. Okay lang yon kasi doon ang gamit nila, doon ka magre-register. Tapos meron ng hybrid, may manual din. Doon nila ipapasok. Ang pinaka-importante lang is that sumunod nga, ipinakita ni Christian Chua kanina na line list data. Ang importante is yung bawat LGU ipadala yon sa pinaka-lalong madaling panahon para ma-make sure na makuha yung registered data na yan at ma-store yan sa ating BIMS. So huwag kayong mag-alala na iba-iba. Importante, yung mga LGUs, ipapadala yung datos na yon sa lalong madaling panahon. And thank you so much for the LGUs. Marami na pong nagpapadala ng maayos. So kailangan pa natin ng konting tulak at tulong ng ating mga kaibigan sa DILG. Ang ating mga kaibigan sa MMDA, grabe ang tulong nila kasi sila ang nagpupukpok sa ating mga LGUs sa Maynila. Pero sa mga LGUs naman sa Kwan, our friends from DILG are really helping so much, as well as our friends from DOH on the regional centers. Okay, thank you. Huwag kayong mag-alala, papasok yan basta ipadala ng LGU.
Okay, thank you very much po, Yusek Manny. So nabanggit na po natin yung issue lang din ng vaccine passport. So one of the issue po ito na maraming katanungan. So Yusek Vergere already joined us in the call po, no? So I'd like to direct this question to Yusek Vergere and Yusek Kaintik. So yung vaccine passport po, do we already have a target when to issue this to our vaccinees?
Thank you, Laura. I'll answer that question first. Sabi ko nga kanina, ngayong linggo pa lang kami magpa-finalize ng ating mga palisiya at guidelines for that at saka yung plano. Ayoko lang pangunahan kasi i-discuss namin extensively with the IATF. And then siguro sa susunod na town hall ay may kasagutan na ako. Thank you.
Thank you po, Yusek Manny. Oh, and then maybe another question for you, Yusek. And for Yusek Vergere. Can we do away po ba with online registration and prod na lang po to go to the site and get the jab? Some sectors said yung online registration po ang nag-hamper for vaccination.
Okay. Kailangan nating mag-prioritize ng Group A. So kailangan muna natin talaga ang registration para ma-make sure muna natin na mauna muna natin mabakunahan yung priority Group A. As we're moving to to Group B at dumating na ang dagsa ng mga supplies, we are contemplating on doing away with registration. But please bear in mind, sabi nga natin kanina, like what Governor Dax and Mayor Francis are doing in San Juan, nakakatulong kasi siya sa crowd control, queue management, para hindi ka maghihintay ng matagal doon sa bakuna. You go when it's your turn. But then, I believe mahahanapan ng paraan yan kung magkakaroon lang ng ibang queue management on the site. So I think our friends from the LGUs and from the local governments have a manual system like Governor Dax said earlier, may paraan sila to make it orderly. And I think Dr. Ong would like to stress further the need for master listing.
Thank you po, Yusek. I just wanted to second your point about the queuing system. So alam po natin na isa sa mga nagiging concern ng ating mga kababayan Yung hindi lang kasi yung oras na ginagamit nila dun sa pagpila, kung hindi rin yung risk ng exposure. Kasi 'di ba nandito na nga tayo, sinasabi natin huwag kayong pupunta sa mga crowded places, dapat may physical distancing, tapos doon pa kung saan tayo magpapabakuna at makakakuha ng protection, doon naman yung pila. So siguro isang magandang reminder ito sa mga LGU, it's an additional incentive na talagang mag-comply doon sa sistema ng mga master lists para mabawasan nga natin yung queuing, kung pwede nga sanang may call system, mas maigi pa. Kasi nga baka naman ang proseso natin na mag-distribute ng bakuna, siya naman na maging source ng mga events na pagkalat or well, I don't want to call it super spreader events, but it can cause disease transmission and we don't want that to happen po.
Thank you po, Dr. Ana.
Could I have a manifestation? Pwedeng magtanong?
Yes, go ahead po.
Okay. Good morning. Good morning. First and foremost, I would like to congratulate San Juan for a very good presentation for their best practices. It seems they are really prepared. No? However, compared mo to other provinces, we have a good electricity, we have a good Wi-Fi, but the problem for other provinces, no, lalo na sa mga far-flung areas, we have problem also with the Wi-Fi. So yun po yung problema namin. So isa pa po, regarding po yung mga kailangan mag-re-register muna, ay paano yung mga senior citizen that they are not knowledgeable on the computerization, no? So yun yung problema, no? Yun. Kaya minsan may policy tayo na walang walk-in, no? But sometimes we should also be flexible, lalo na pag si Lola ay nag-iisa lang sa bahay, no? Yun yung isang first question ko. Second na comment ko po, to Dr. Lynn, no? Hindi ho mabagal ang local po na magbakuna. But the problem is, we have inadequate vaccines. Yun yung po ini-inform. At this point in time, in Cavite, ang dami na pong municipalities na wala ho kami vaccine, kagaya ng Bacoor, Dasma, Trece Martires, Silang, Mendez, wala ho sila ngayon vaccine. So, yun po, hindi ho kami mabagal. Hindi mabagal yung local. I just want to correct your comment kanina po. Thank you. Maraming salamat po.
Thank you, ma'am. Mr. Jelly, you'd like to answer po? How are we making, facilitating the registration, especially of our senior citizens, because you've done so efficiently in your city?
Yes. Not all our senior citizens, not even all our citizens have internet access. So, and not everyone has good internet access. So what we do is we do the house-to-house online on-ground registration. So we go house to house, we have this form, we help them. In fact, our people do the filling up of the form already. They just have to tell us their information and the data. And then that's what we keep and we put them and we schedule them in our system. This is to help our constituents who do not know how to access the internet, do not have access to the internet, yung mga ganun po. We also send our barangays. Every day po yan. All our barangays have to go out and go do house to house to ask people, nakapagbakuna na ba kayo? Gusto niyo bang magpabakuna? Tapos for those who have vaccine hesitancy, kino-convince po sila with our talking points po.
Maraming salamat po. So it's a combination of providing operational support and of course communicating properly to our constituents. Dr. Anay, would you like to add something po?
Yes, thank you. Response lang kay Ma'am Lisa. So thank you for raising that concern, no, na supply ang problema. So I think yung isang ang realization dito, in as much as yung implementation is really very LGU driven, kailangan natin ng magandang coordination system. And yung mga na-share ni Sir Brian regarding yung best practices ng San Juan, yung comment ni Governor Dax about the difference, no, between the urban and the rural setting, I think makikita talaga natin dito yung laki ng role ng LGU and LCE and siguro yung need na magkaroon nga ng magandang coordination between the different components of the supply chain. So siguro in response lang to what Ma'am Risa said, kung wala nang ang vaccines, then we really also need to include this element in forecasting para hindi naman tayo nagkakaroon ng gap dun sa supply at saka naman dun sa operations teams on the ground na ready naman magsilbi at wala naman palang pwedeng ipamigay. Thank you po.
Thank you po. And gusto ko lang din pong ulitin yung sinabi nyo that vaccines are an added layer of protection. We still have our PDITR and MPHS, no, to keep us protected from the COVID-19 pandemic po. Yes. Yusek Verhere, would you like to go on po to our synthesis?
Yes, Laura. Wala na tayong questions from the floor.
Mostly naman po, sige, pwede po nating itanong to kasi I think from the independent analysis of Dr. Wong, nabanggit po yung second dose, no? Hindi nakarating sa second dose. But Dr. Ana also contextualize it that nagkaroon din talaga tayo ng surge. Kaya some of those na nakaschedule for their second dose ay nag-defer din because nagkaroon din sila ng infection. So what are the things that we're going to do po to ensure that the second dose, paano po natin hikayatin yung mga tao na magpa-second dose po, no, at kompletuhin ang kanilang protection against COVID-19? Yusek, you'd like to start?
Una-una, kailangan po malaman ng ating mga kababayan that first dose is really not enough. Sinasabi na po ito ng lahat ng ating mga eksperto that you need to get your second dose because it provides you with the maximum potential ng bakuna. Ibig sabihin, yung protection po na ibibigay sa inyo ay pinakamataas kung kayo po ay makakakuha ng inyong second dose. Ngayon, dun po sa mga nagkaroon ng sakit, na-expose, nag-quarantine at hindi po nakuha ang kanilang mga second doses, immediately after that you get sick and you are declared recovered, ibig sabihin, pagkatapos ng 10 araw na isolation, wala nang simptomas o di kaya wala kayo talagang simptomas pero positibo kayo after 14 days of isolation, pwede na po tayong magpabakuna immediately after. Wala na po tayong bibilangin pa na araw. So we encourage everybody na nagkaroon po ng mga deferrals because hindi po nagkaroon ng mga kani-kanilang sakit, maaari po kayo magpabakuna uli. Para naman po dun sa mga tao na hindi nakabalik sa tamang schedule, maaari pa rin po kayong bakunahan ng second dose. Hindi po kailangang ulitin na first dose po ang ibibigay sa inyo. Bumalik lamang po kayo sa vaccination site and you will be given your second dose. So I guess the experts, Laura, can weigh in on this as well.
Yes, Yusek Verhere. For Dr. Ana, itanong ko na lang din po, no, paano daw po nagiging significant ngayon na ang Sinovac din ay may EUL na or nakasama na sa WHO EUL natin? Maaari din ba itong makatulong para sa may mga agam-agam pa sa pagpapabakuna?
Ang EUL, we need to view it as something like a quality seal na ibig sabihin ay pumasa siya dun sa pagsusuri ng WHO base din sa kanilang independent review ng mga datos na sinasubmit ng manufacturer. I understand that aside from data review, pati manufacturing process, tinaanan din ng WHO. So nag-visit pa yan ng planta, tinignan nila kung paano ginagawa yung bakuna. So kumbaga, na-verify ng WHO na itong produktong ito ay ginagawa ayon sa mga accepted standards at yung visa and safety na kanilang kine-claim ay validated, no? Hindi lang kung saan-saan nila hinugot yung kanilang mga numero. Now, with that, no, dahil pwede nang kasama or rather nabigyan ng EUL ang Sinovac, pwede na ngayon siyang bilhin ng COVAX facility at maisama dun sa mga bakunang ino-offer ng COVAX facility sa iba't ibang mga bansa na nangangailangan ng extra supply. So for us, that's very good news kasi hindi na lang yung mga dating binibili ng COVAX, kung hindi pati itong produktong to ay pwede na rin i-procure ni WHO and therefore mas dadami yung doses na pwede nilang ipamahagi sa mga bansa tulad ng Pilipinas.
Laura?
Yes, go ahead po, Yusek.
Yes, I'll just add one thing, advantage din po nung napasok sa EUL ang Sinovac, kailangan po natin maintindihan there is this mutual recognition across different countries for regulatory processes. Meron ho tayong mga tinatawag na PICs at saka yung MRA, no, na tinatawag na mutual recognition agreements, kung saan kapag ang isang bakuna ay nakapasok sa WHO EUL, it is recognized across countries already at mas mabilis pong nare-recognize ng bawat bansa na yan itong mga bakunang to. So it's going to be something of an advantage kasi yun po mga ginagamit natin dito mostly are Sinovac, and then it can be recognized as well in other countries. So hopefully this will be one of the advantages of this Sinovac getting an WHO EUL.
Thank you, Yusek Vergere. Before we end and ask Yusek Vergere to do her synthesis, maybe Dr. John Wong can reiterate yung key messages of our prioritization framework.
Thank you, Laura. So, from what I presented, my recommendation is that to make it easier for LGUs to sign up people, no, just do it by age. No? Because it's easier to verify than comorbidity and or employment. No? So you can start with 50 and above because they're at the highest risk and they have the greatest impact. No? Kasi just vaccinating them alone can prevent 80% of the deaths. And then after you're done with that, no, or after you're almost done with that, then you can go in decreasing order down by 10-year age groups. So I think that's the easiest, no, most implementable strategy for LGUs. Thank you.
Thank you very much, Dr. John Wong. So the national government has moved to, particularly for the NCR plus area, magkaroon na po ng simultaneous vaccination sa ating A4, of course, with providing priority pa rin po sa A1 to A3. Si San Juan City po gave us paano ba sinusuyod yung A2 particularly, no? Yung mga hindi tech savvy para ma-register din, at nakita naman natin na sa stats nila handa na silang magbakuna ng priority group A4. Yusek, your synthesis.
Yes, bago po tayo magbigay ng synthesis, I just like to again thank our experts, Dr. Ana Ong Lim, Dr. John Wong, and of course, Yusek Manny Kaintik from the ICT, Mr. Brian Gelly from San Juan City, and lahat po ng dumalo dito po sa ating town hall meeting na ito, including Governor Dax, no? And I think he has a very spotty internet kaya nawawala-wala po siya. ULAP, DILG, and all of the other LGU officials who are here, and the other leagues of mayors, provinces, vice mayors, vice governors, at lahat po ng bumubuo sa mga participants natin ngayon. Thank you very much po. The prioritization framework is geared towards utilizing the limited supply of COVID-19 vaccines to protect the most vulnerable, to protect the exposed sectors of the population, to secure safety, and to minimize the loss of human life. The prioritization framework does not entail exclusion. Wala po tayong iiwanan dahil nagpa-prioritize po tayo. Ang ginagawa po natin, naglalagay lang po tayo ng mga mauuna because we prioritize, and then the rest of the population will follow. The National Deployment Vaccination Plan for COVID-19 ensures that all eligible Filipinos will be given the COVID-19 vaccine. So following the prioritization framework, it ensures that our distribution is in an equitable fashion. Pag sinabi po nating equity, we are biased towards those who are most vulnerable. So meaning that those who are most at risk of COVID-19 and severe disease or death are the ones who will be first given the protection of the vaccines. Dahil katulad nga po ng sabi ni Dr. Ana and Dr. John, kung uunahin po natin sila, we lessen the stress in our healthcare system. Ang ospital po natin ay magiging manageable, magkakaroon po ng readiness sa ating health system, and tayo po ay unti-unti makakaagapay sa pandemyang ito. Processes are in place to facilitate excellence in our master listing. However, we must encourage our constituents to register and be master listed. So katulad ng sabi po ni Yusek Manny kanina, ginagawa po natin ito because we would want our vaccination sites, and our process, no, organized po tayo. Sabi po ni Dr. Ana, this is to prevent queuing, this is to prevent this crowding in our vaccination sites, kaya po tayo nagkakaroon ng master listing. Gusto ko lang pong idagdag na nagma-master list din po tayo para meron po tayong appropriate na data system sa ating local governments. Nakalista po kayong lahat dyan. Wala pong maiiwan. Lahat po ng tao dyan sa bawat local government ay mabibigyan ng bakuna basta sila ay eligible. It is important to adhere still to our minimum public health standards. Ngayon po usap-usapan na kapag fully vaccinated, we can give liberal incentives. Pwede nang lumabas, pwede nang mag-travel and all. Sana po, let's take this as a para bang gradual po tayo. Gusto po nating mas maging maingat pa rin sa ngayon, lalong-lalo na may mga variants po tayong nakikita. Meron ng mga pagtaas ng kaso sa iba't ibang lugar sa ating bansa. So we will do this gradually. We are not closing our doors. No? In fact, we are discussing already with other agencies, pero kailangan pag-aralan maigi. Kaya kailangan pa rin, tuloy-tuloy pa rin ang minimum health protocols plus have yourselves vaccinated when you are already eligible para po maproteksyonan ng sarili nyo, ang inyong pamilya, pati na rin po ang buong komunidad. So maraming salamat po sa inyong lahat. Over to you, Laura.
Maraming salamat po. For our closing messages, may we hear from Undersecretary for Local Government, Yusek Marlo Iringan of the DILG.
Salamat, Ms. Laura. Magandang tanghali po sa ating lahat. Good noon, everyone. Secretary Francisco Duque, Undersecretary Maria Rosario Berhere, and other officials of the Department of Health, our colleagues from the DICT, the experts who have shared their valuable insights and knowledge to us a while ago. Of course, our salute to the Union of Local Authorities of the Philippines, particularly Governor Daxco of Quirino Province, our governors who are with us, mayors, and other local officials and functionaries who are now tuned in via DOH live streams in Facebook and YouTube.
Yusek, you're on mute po.
Yes, thank you, Laura, for pointing that out. Well, anyway, we'd like to greet Secretary Francisco Duque and other officials of the Department of Health, our colleagues from the Department of Information and Communication Technology, our experts who have shared their experience and valuable insights a while ago. Of course, I would like to greet our partners from the Union of Local Authorities of the Philippines, headed by Governor Daxco of Quirino Province, the governors, mayors, and other local officials and functionaries who are now with us. Sa atin pong lahat, isang magandang tanghali po. This time, we'd like to thank DOH for inviting DILG to be with you in this activity. On behalf of our Secretary Eduardo M. Año, we commend the Department of Health and its partners in continuing the commitment to educate all of us and coming up with this session. Indeed, we agree that vaccination, prioritization, registration, and master listing is one of the pressing concerns, not just by the national government, but most importantly, at the local government units, in as much as LGUs are tasked to operationalize and implement this in the respective jurisdiction. Nabanggit po kanina ni Dr. Ana Lim ang laki ng responsibilidad ng ating mga local government units. And therefore, to end this fruitful town hall session, please allow me to reiterate and share the latest issuance from DILG Secretary Eduardo M. Año as contained in DILG Memorandum Circular 2021-057 on the guidelines to fast-track the COVID-19 vaccination rollout in all our local government units. We agree that the national government recognizes the need to speed up the inoculation of more Filipinos in order to achieve the President's directive during his talk to the people last month. The DILG is one with the DOH and other national government agencies to speed up the vaccination, and our local government units, ably supported by the national government, are at the forefront or are frontliners in order to achieve this very objective. The MC that I mentioned a while ago, issued by the Secretary, mandates our local officials to prioritize the swift administration of vaccines to eligible populations in all phases of the national vaccination program. with strong adherence to the pre-identified prioritization groups discussed earlier. And therefore, we believe that it is the responsibility of our local government units to, number one, help speed up the process of master listing and vaccination. Number two, comply with the prioritization category being imposed by the national government, and this was repeatedly mentioned a while ago. Number three, boost the people's confidence by coming up with an effective and aggressive communication and information drives. And number four, look into the good practices of other local government units as a reference in order to improve performance of our LGUs. We have heard the experience of San Juan a while ago, and if you notice, no, yung kanilang best practice, the first thing that our colleague from San Juan mentioned is the early preparations that the LGU has put into all of these things. I'm very sure it did not happen overnight. I'm very sure that it took some time for them to really sit down and plan so that they can put in place all these systems and procedures in order to make sure that the program is properly implemented in the city of San Juan. And it is our hope and our prayer that our local government units, other local government units, will also do the same. Moreover, in the MC that we issued, the Secretary directed the Philippine National Police and the Bureau of Fire Protection, those with trained medical personnel, to help and augment the existing LG workforce for efficient and speedy conduct of inoculation. The guidance of Secretary Anyo to our LGUs is to simplify the process of master listing and registration, simplify the data and information requirements for faster approval, and most importantly, simplify the actual administration of vaccine through deployment of mobile vaccination units, creation of drive-through vaccine sites, and if possible, a house-to-house administration to vulnerable groups with special needs, whichever is applicable in the local government unit. Indeed, we are just at the beginning of this journey. We are only scratching the surface. Our target supposedly is 70% of our population to be inoculated. And at this time, we have already vaccinated more than 5 million Filipinos. So we still have a lot of work to do. And it would be best if we have already our systems in place so that when the bulk of the vaccines will arrive, we are ready for the mass vaccination. On the part of our local government units, successful and effective communication strategy is important. We have to encourage the rest of the population to register and submit to vaccination. That is why we encourage our local officials to post photos as you have your first and second dose in order to boost confidence of the people in the vaccination program. Iba rin kasi pag nakikita ng mga kababayan natin, yung kanilang mga local officials ay talagang they subjected themselves to vaccination. And it really boosts confidence of the people in our vaccines. Nabanggit kanina ni Dr. Annalyn, the message actually is very simple. Once na may EUA na, emergency use authorization, ang mga bakunang ito ay ligtas at epektibo. So yun po yung isang napakasimpleng mensahe na pwede natin ibigay sa ating mga kababayan. And therefore, I do believe that it is important for our LGUs to open more platforms for registration and master listing. It is really high time that our LGUs embrace technology and incorporate it in its own governance as we are being ushered to ICT-based governance reform. And the only thing there is for our LGUs to do is to embrace and adapt the convenience of technology. We know that with IT-based systems and applications being implemented by our local government units, people can now do registration and scheduling for vaccination at the convenience of their house or their homes. LGUs can now develop the master listing and approval with swift and ease. Of course, we also know that there are local government units that are still challenged in terms of connectivity and information technology, particularly with respect to structures and facilities. In such cases, our LGUs are directed to conduct manual listing at designated sites at the barangay or actual house-to-house census by barangay personnel and volunteers. We have seen how San Juan did it. They combined both the ICT system and the traditional way, that's house-to-house campaign. Indeed, there are still many administrative and logistical needs that require our utmost attention and perseverance. This is not just the responsibility as a nation. Ang pinakamahalagang aspeto sa lahat ng ito ay ang pagtutulungan ng bawat isa. Alam ko, babalik at babalik tayo doon sa pinakasimpleng solusyon. At ang solusyon ay ang bayanihan. We have to work together as a team. We have to overcome together as a team. Kaya natin itong malalampasan kung tayo ay magtulong-tulong at magsama-sama. So again, at this point, our congratulations to the Department of Health for organizing this activity. Let us continue this conversation in the days ahead. Maraming salamat po at mabuhay tayo lahat.
Maraming salamat po, Undersecretary Iringan. Tunay po no, that the discussions that we had now is supportive of the A1 to A3 prioritization, but also expanding it to our A4 priority group. With that, we are lucky to have the Secretary for Health to do the closing remarks for this very productive town hall session. Sec Duque, please.
Yeah, thank you very much, Laura, for the kind introduction. Muli, isang maganda at malusog at mapagpalang araw sa ating pong lahat. Unang-una, maraming salamat kina Dr. Ana Ong Lim mula sa ating walang kapaguran Technical Advisory Group. At ganoon din naman si Dr. John Wong ng Epimetrics Incorporated, Yusek Emmanuel Kaintik at Mr. Joey Singyan, at si Mr. Christian Chua ng DICT, Mr. Brian Jelly ng San Juan City, at of course ang ating katuwang ang DILG Yusek, Marlo Iringan ng DILG para sa pagdalo at pagbabahagi ng kanilang kaalaman sa town hall na ito. No? So maraming salamat rin sa mga kinatawan ng ULAP, ating mga regional CHDs, at mga manunood natin mula sa ating social media channels. Napakahalagang agaran maihatid ang proteksyon ng bakuna sa mga grupong lubos na mataas ang peligro sa COVID-19 gaya ng ating mga healthcare workers, senior citizens at ang mga mamamayan meron na comorbidities. At dahil sa limitadong supply ng mga bakuna sa ngayon na dumarating sa ating bansa, nagkaroon tayo ng prioritization scheme, no? At nakita natin sa town hall na ito ang kahalagahan ng isang prioritization scheme upang masiguro na ang mga pinaka-nangangailangan nito ang unang nakakakuha ng bakuna laban sa COVID-19. Gaya na lamang ng mga healthcare workers na mag-aalaga sa atin pag tayo ay nagkasakit, o kaya ang mga senior citizens at persons with comorbidities na mataas ang tsansang makakuha ng malubhang COVID-19 at mamatay dahil dito. Yan po ang ating mga gustong iwasan. Huwag tayong mag-alala sapagkat lahat naman tayo ay makakakuha ng bakuna kapag dumami na ang supply. Nito sa ating bansa at ang ating mismong vaccine czar na si Secretary Galvez at ang ating mga ambassador sa iba't ibang bansa ay puspusan na ikipagnegosasyon upang makapagpadala ng mga bakuna dito sa Pilipinas. Ngayon Hunyo ay may inaasahan tayong 9 milyon na bakuna na darating sa bansa ayon kay Sec Galvez at malapit na rin tayo magsimula sa pagbabakuna ng A4. So patuloy din po ang ating panawagan sa ating mga lokal na pamahalaan na siguraduhin ng ating mga kababayan na nasa A1, A2 at A3 ay may access sa pagrehistro sa pagbabakuna. Kasabay ng ating pagbabakuna, atin din pong ipagpatuloy ang mahusay na implementasyon ng ating PDITR strategies at mga safety protocols upang maiwasan po natin ang pagtaas ng kaso ng COVID-19. inaanyayahan ko ang lahat na kapag tayo ay nabigyan ng pagkakataon ay piliin natin magpabakuna laban sa COVID-19 upang maprotektahan ang atin pong mga sarili at ang atin pong mga pamilya. Muli, sa ngalan ng Department of Health, isang magandang umaga sa ating pong lahat.
Maraming salamat, Secretary Duque. And maraming salamat po sa lahat po ng mga umattend, no? We have mayors from all over the country and governors as well. Thank you, Yusek Dumama. Thank you, Yusek Rosette, and to our experts sa susunod po nating town hall.